The topic of this talk is on health assessment at community and population levels. The three main themes that I'd like to cover here is that process that's used for an assessment, this idea of assessing not only problems but also capacity and assets, and the importance of including a social assessment. The slides used in this talk come from various chapters in two health promotion textbooks, and I've uploaded these slides to Blackboard and used the chapter numbers at the top so you'll be able to see where the slides are coming from. I think it's important to first start with a definition of a community and to think about how a community differs from a population, as we've talked about populations in the text we're using for Nursing 810. A community differs from a population, I would say, by these parameters that we see here under these sub-bullets. So both communities and populations are a group of people who have common characteristics, but those characteristics may simply be demographics or being in a population that's at risk for developing diabetes. But a community brings in some additional dimensions. For example, here, this idea of a sense of identity and belonging, this idea of shared values and norms, and this commitment or this emotional connection that comes from belonging to a community. And this community can be literally a physical community that's defined by geography. So we think of the Madison community. We have various neighborhoods within Madison that have a tighter identity in terms of communities. We also have communities that obviously come from a shared identity. For example, the LGBT community has these shared commitments and emotional connections that make them a community. Chapter 3 is posted online, and in that chapter, a variety of models that are used for program planning at a community level are shared. And they start the chapter by describing this generalized model that starts with assessment. And this model is very similar to the nursing process that's used at a patient level. What's important to point out here is that this assessment includes both subjective and objective information. And then that assessment is used to prioritize what is needed in a given population. So you're not only prioritizing the need, but you're also prioritizing that need for a given population. I'd like to point out that there is another talk about goals and objectives and evaluation, and those are both posted under the tab with Paper 1 and Paper 2 content. So let's delve deeper into what is involved in a community assessment. The content from the next few slides is from Chapter 2 and of this textbook, and I have uploaded that book chapter on Blackboard. I think it's an excellent chapter, so it's a great resource if you want to flesh out your understanding of what I'll barely touch on in these couple slides. So the case they make here is that it's important to look at needs from both the professional view, so if you've got people from your healthcare organization and from your public health department and maybe community health organizations looking at this assessment, you need to also include the point of view of the people who live in the community, because they will see both the objectives and subjective indicators of health from a different point of view. And that point of view is very well captured in this quote. We don't see things as they are, we see things as we are. So we bring our own biases to looking at any situation. And I'd like to back up and point out that this variable lens of professionals and lay people comes from their knowledge and their experience. And that knowledge and experience will vary across the professionals, just as it will vary across these lay people who are at the table. But they are all valuable sources of information. And just as we are interested in collaborating with patients on decisions about patients' care, it's not just health professionals telling the patient what they have to do, but the patient should have a say in the types of treatment they will get. It's the same at the community level. And it points out this important idea that who we are is a combination of what we know and what our experiences are and what our values are. And those things all come into play in terms of how we see things. Part of that assessment should be an assessment of the capacity within a community. The community's ability to define and solve their own problems. And you can see in these elements of a situational analysis some of the things that you might want to assess. Their aspirations and concerns, those capacities and resources that they have. So what are those community assets? Potential barriers that could inhibit a program getting off the ground. The goals and resources that we've mentioned before. So putting this all together in an analysis that includes these capacities and these assets. So here we're seeing a neighborhood asset map where they've looked at these various assets within a community who can contribute to these organized efforts to promote health. And they've categorized these as primary and secondary, but the main take-home message is, not only do you want to look at problems within that community, you also want to look at these assets. Chapter 9 talks about some of these same ideas, but they do so with a slightly different language, and talking about this from a perspective of community organizing. Starting out, I think it's helpful to start out by looking at where this idea of community organizing came from, and it was this process by which communities were helped to identify problems, mobilize resources, and implement strategies so they could reach there. So it was really this idea of community empowerment, fostering community participation and community partnerships. So these are all buzzwords that are commonly used when we talk about community health promotion work. And another term that is commonly used now is also this idea of participatory research. So if you're going to look at what's going on in a community as part of an assessment, even thinking of it as researching what's happening in a community, that you should involve those community members in a participatory research type of perspective. I think it's useful also to look at these assumptions, and assuming that communities can develop this capacity to deal with their own problems, which is kind of first and foremost, and that if people are participating and they're doing things that are important to them, that it's more likely to be sustainable. And they often bring these ideas of democratic principles of cooperation into the conversation as well. Here I'd like to touch base briefly on these various categories of stakeholders that may be involved in a community organizing effort. So at the top you've got these executive participants who are really this small committed group who are going to move this forward. They will meet more frequently. They will do the lion's share of the coordinating of this effort, and it's typical to provide to appoint a leader or coordinator. In fact, it's necessary to have this because you really need that leadership at the table. It is important to think about who should be included here because you need to have the credibility of the effort. So you wouldn't want to leave out an important faction that should be included in this committed core group. I would say it's very important to have a member of the community represented to give that community credibility, and who that person is obviously would matter. You also have these active participants who are also committed to doing work and working closely with these executive people at this executive level. It's interesting to think about those occasional participants who have certain expertise and need to be there when certain decisions are made. And then those supporting participants who may not really be that involved in the planning, but they are willing to provide, for example, resources. Maybe it's funding, or maybe it's buildings, and they definitely need to be on board, but not necessarily participating in what the at the planning level of these other groups. So they also included a bullet at the bottom here talking about coalitions. And coalitions are these groups of representatives from different perspectives, different professionals, different people representing the community, other entities who come together around an effort. For example, we have an asthma coalition in Madison that it consists of healthcare professionals, it consists of professionals at community levels, it consists of parents with children who have asthma and asthmatics as well. So the idea is to coordinate efforts that will improve population health outcomes for people who have asthma. I'd like to finish up by talking about how one goes about acquiring the data that they need for their needs assessment. There are two primary sources of data, and the first is primary data, and that's data that is being collected specific to your needs assessment. And so you're able then to ask those questions, answer those questions that you have via the methods, and with a certain caveat. I mean, you may have questions that are unanswerable, which is not uncommon, but for those that you are able to devise a way to answer them, this is an advantage. They talked about here about they're often collected via interactive contact methods, and what they mean by interactive is something like an interview or a focus group, where you're actually interacting with community members in order to understand their point of view. Photo voice is another. You can read about photo voice in these pages here, and photo voice is where a method by which you have people take pictures in their community that mean something to them, and then they describe what they mean. The disadvantage of primary sources of data is that it can take time, it can slow you down, and it can be expensive. Secondary sources of data are data that have been collected by somebody else and often for another reason, but they may, there's a lot of secondary data out there, and often a lot of data that can be very useful, and it's from multiple sources. Those multiple sources are described in your textbook. Here's the pages where that content is covered, and there's a table, and I also posted some links on Blackboard in Module 4 where you can access data. So the advantages is that it's just a matter of locating that and drilling down to get to that specific aggregate that you're looking for. And I would say the disadvantages are that often, you're not finding exactly what you look for, and sometimes you'll get something on a county level, but you want it on a city or village level, and if you're looking for rural data, sometimes that data is difficult to find. So in sum, I hope this short talk gave you some insights into the importance of social assessment, the importance of including an assessment of assets in addition to assessing problems, and finally involving community members when prioritizing those needs that should be addressed within a community. are some of the disadvantages.